We're going to talk about Chapter 1, specifically the foundations of behavioral neurosciences, where it got its roots, and what some of the theories and where they originated from with some of the big players, along with some theories that went along with them. Even at our very early understanding of how the human brain works, philosophers and scientists understood that the brain generally does not change in adulthood. There were a lot of theories that they did change a lot in childhood, but it was widely not understood. Today, we have a very good understanding of how neurons work at a molecular level, and even how neurogenesis and plasticity play in the role of repairing the mind's functioning across many behaviors or tasks that we're trying to complete. So if we're going to get a good understanding historically how biopsychology took its roots, we really need to understand how research works, how it worked in the past, and how it works today. Throughout your book, it gives several examples of how we have observational research, we have experimental research, we have case studies, but in every situation, there's a scientific approach of asking a question and being able to answer it. And that's what we saw with Aristotle, who took roots in believing that there would be more of a medical understanding of how the brain works, instead of using theories that didn't really hold any kind of scientific approach. In any case, we do use generalization, similar to any kind of investigation, to make assumptions and deductions to predict outcomes in behaviors. As much as we really want to believe that psychology is a hard science, it is a soft science. That means we don't have proofs like we do with math or science or physics, but we do operate on theory that we're able to generalize and apply across most situations. And of course, in most situations, there are outliers. But for the most part, behavior can occur for many reasons. There's not necessarily one factor that covers everything. So understanding that physiology is more of the hard science, but psychology is more of the soft science, that's going to help you moving forward with these lessons. The goal of any research is going to be generalizing and trying to perform deductions enough to make solid predictions. And that's essentially what we're looking at with behavioral neurosciences. They are interested in the study of behaviors, but they're also experts in physiology. They understand both sides, the medical and the theories of behavior. Within the biological roots of neuroscience sprang two schools of thought. One was dualism, and that's the belief that the body and the mind are two separate, non-identical entities. Opposite of that would be monism, which is the mind and body are manifestation of a single substance. And it looks at it more from a scientific approach as opposed to theories and generalizations. So science progresses into neuropsychology, the need for a working model of a brain became very apparent. Johann Mueller, in the 19th century, he was a physiologist. He developed the doctrine of specific nerve energies. This model here isn't what he proposed, but it gives a good depiction of pinpointing areas of brains and the neural pathways that go in between it. Going even further back to 460 BC, Hippocrates, who was considered the father of science, medical science, he postulated that the center of behaviors and emotions is the brain. About 2,000 years later, René Descartes, a Frenchman, who's considered the father of modern philosophy, started considering that dualism is separate from the medical side of things. So he really pushed the philosophical realm of what Hippocrates was trying. A few other key people that had major influences in neuropsychology, just to run over a couple of those names, where one was Luigi Galvani, who coined the idea that we have electrical impulses that go through our nerves and our nervous system, and otherwise known today as galvanic skin response, which we see in a lot of stress tests and even the modern polygraph. Johann Mueller, we talked about the doctrine of looking at the model of the brain as a neural pathway, making a map of that. And another notable name in this is Pierre Florence, who really started delving into taking out brain tissue and do experimental brain surgeries and studies to see what happens with functioning that follows with the damage. Another big name that shows up in neuropsychology is Paul Broca, who was celebrated for his discovery of speech production center of the brain located in the ventroposterior region of the frontal lobe. This is known as the Broca's area, which we're going to learn about in later lessons when we look at the biological functions of the brain. But he arrived at his discovery by studying brains of aphasic patients, or people with speech and language disorder suffering from brain injuries. And then Gustav Fritsch and Eduard Hitzig were also experimentalists and looking at electrical stimulation in the brain, similar to what Pierre Florence did. But they were very into figuring out if certain areas were damaged or excited based on electricity and how that translated into behaviors and reflexes within the body. And last on this slide is Jan Percagnier. His contributions were the electrical signals of the autonomic nervous system, especially in the heart area, where he found electrical signals behind the ventricles that created impulses and kept the regulation of the heartbeat. As we move through over 2 millennia, researchers and philosophers alike and anthropologists have produced several models of the brain that have moved up through the ages and became more detailed. But most of our work has taken shape in the 20th century, where we started understanding the electrical chemical messages and how they flow through the body and the nervous system, and from the brain to the other areas of the brain and body. And now in the 21st century, we're getting a clearer understanding, especially given some of the technology that we use today with the functional MRIs and the PET scans and CAT scans. We are gaining a little bit more of an understanding how certain behaviors are activated in certain areas of the brain. As we get into more of a multicultural situation, the world has obviously shrunk in size with the information age. We are seeing far more cultural influences. A lot of the science that we have had has been influenced by Western and Eastern European models, but we are expanding on that to get a better understanding of gender and different ethnicities and country regions within the world. So that's all I have for this chapter. If you have any questions, I do encourage you to post them in the discussion post so that other students are able to respond to that and I can see them as well. At the same time, if you have any other questions or difficulties understanding any of these things, I really encourage you to send me an email and I'd be happy to help you out with that.